and regions where the disparities are more pronounced. Since the topic of this meeting is essentially linked to COVID-19, the weekly meetings when they started out, I thought that it was important to have a first slide just talking a little bit about COVID-19 and its impact on patients with cancer. Of course, the pandemic has affected us in many, many ways. But when the pandemic started back in 2020, we, in the world of oncology, there was a huge impact on patients, those on active treatment, those who were going through for regular screening on the prevention side. So there was, of course, an impact on cancer screening. There was an impact on treatments with patients with cancer on the active side, and of course, late stage diagnoses. So putting all this together, we are expecting a surge in cases, cancer cases, new cases in the coming years. So why cancer? So cancer as such is a very complex group of diseases. It is currently the second leading cause of death globally, and it's already number one in many regions of the world, racing towards becoming the number one leading cause of death in the world. 40% of cancer cases are preventable. 1/3 of cancer deaths are linked to tobacco use, alcohol consumption, unhealthy diet, lack of physical activity. 30% of the deaths in the LMICs, or lower and middle income countries, are caused by virus-related cervical and liver cancers. And most importantly, especially focusing on the LMICs and lower income countries, early diagnosis is absolutely crucial to reduce premature mortality, because premature mortality is again focusing on the 40% of cancer cases that are preventable. If we can prevent those cases, then we can focus on the 60% of cases that absolutely need to be treated. When you look at the figures, the facts and figures, according to the Global Cancer Observatory, which is a tool of the International Agency for Research on Cancer, 19 million new cases were estimated in 2020, and the number of estimated deaths for all cancers globally was around 10 million. If you look at the graphs, you see that over 50% of the cancer burden lies in the Asia-Pacific region, with the mortality reaching almost 60% back in 2020. When you look at the future, in terms of the estimated number of cases by 2040, we see that there is an expected increase of around 56% new cases, cancer cases, by 2040 globally. And then when you try to look at the region, since the audience over here is the Asia-Pacific region, the estimated regional increase is that of 52% by 2040. I'd like to point out that these figures are, of course, updated on a regular basis. That means that if in 2020, the estimation of new cases by 2040 was 14.6 million, when Global Can does another update, the cases will definitely rise because the cancer burden is increasing on a daily basis. So the question is, are we prepared for it? Unfortunately, at the moment, with the current situation, the answer is no. Cancer right now is the leading cause of premature mortality in lower and middle income countries and lower income countries. As you can see from this graph, which has been prepared by the World Health Organization, the regions in blue are essentially those that rank quite high when it comes to dealing with premature mortality, or they have a very low premature mortality linked to cancer. And the regions in red, which are primarily in the African region and also in the Asia-Pacific region, are those where premature mortality is not being dealt with in the way that it should. Therefore, the countries in blue, or the higher income countries, mostly, and upper middle income countries, are working towards dealing with the 60% of cases that need to be treated, because they have tried to deal with the 40% that could be prevented, even though a lot of work still can be done in those regions too. But the regions in red still need to tackle the 40% that can be prevented, 40% of cancer cases. So we've talked about the number of cases and the facts regarding oncology across the world and regionally. But when we talk about cancer policy, what exactly does it mean? The first phase in this is to start from scratch, i.e. review the status quo. That means understanding the burden of cancer nationally, ideally through disease-based registries, evaluating the existing workforce and infrastructure versus cases nationally. The second phase is to develop a national cancer control plan, considering the epidemiology of cancer, available resources and needs, and national needs. And the last and most important phase is to implement the National Cancer Control Plan tailored to the country with an emphasis on prevention in lower and middle income countries and lower income countries, and building a solid infrastructure to deliver care. But before we talk about the ideal scenario when it comes to cancer policy, it's also very important to acknowledge the global disparities in income levels, which can be seen from this graph. The higher income and the upper middle income countries are reflected in the blues, and the lower middle income and the middle income countries are reflected in the reds. The income disparities inevitably lead to inequities in care, which are in turn indicated by the availability or lack thereof of comprehensive cancer treatment. As you can see from this graph, more than 90% of high-income countries have treatment services for patients with cancer, and less than 15% of low-income countries have treatment services for patients with cancer. So what are the important developments regarding cancer policies? Once again, we have looked at the facts and figures. We have understood that there's going to be a surge in cases in the coming years, also partly linked to COVID-19, but also linked to late-stage diagnoses and many different aspects of the oncology spectrum. The point that I wanted to emphasize is that we all know that healthcare in general is a national competence. That means that every country will be developing health policies and plans that are relevant and important for the benefit of their citizens, for the healthcare of their citizens. But when there are areas that require the world and regions to come together to tackle a particular area, which is affecting every single country in the world, public policies need to be made at the supranational and regional levels. And also organizations and entities such as the World Health Organization, which is a specialized agency of the United Nations, they also start focusing on these areas in order to make sure that the world is prepared to deal with such important, such complicated diseases. So from this graph, as you can see, you see that at the global level, there is indeed a focus on cancer. There is the Global Breast Cancer Initiative, the global strategy to accelerate the elimination of cervical cancer, 2 cancer resolutions that were created by the World Health Organization. At the European Union level, which is a regional entity comprising of 27 EU member states, where health is still a national competence, all the countries came together and decided to create Europe's Beating Cancer Plan. And I'll talk about that a little bit in a second. They also created European reference networks, which focus on rare cancers. And lastly, in the Asia Pacific region, since the audience is indeed from this region, we have the National Cancer Control Plans or non-communicable disease plans in most countries. So I talked a little bit about Europe's Beating Cancer Plan, and I want to spend a little bit of time on this. So in Europe, as you know, we have the supranational body of the European Union that aims to oversee the welfare of the 27 EU member states. Healthcare is always a national competence, but when it comes to certain areas, certain topics which affect all the countries, the 27 EU member states came together and they decided to focus on cancer because they realized that the burden of cancer was increasing, and if nothing was done to tackle it at this particular moment, in the future it would be very, very hard for the union as such to tackle it. And also cancer is being used as a pilot case because as the lifestyles are changing, the population is aging, the diseases are becoming more complex. Therefore, if we're able to treat cancer in a holistic way, and provide the best care to the citizens and the people in the world, it will be much easier for us to tackle all the complex diseases that are to come in the future that we don't even know of. So in Europe, the 27 countries came together. They developed the Europe's Beating Cancer Plan, which currently has 10 flagship initiatives, which are based on the data that has been collected in the European Union. These initiatives are then supported by over 70 supportive initiatives. The Beating Cancer Plan brought the countries together, and it now forms the foundation for any and every policy that aims to tackle cancer. But since we're talking about the Asia-Pacific region, I would like to highlight a few challenges that the region is currently facing. The region as such is a very heterogeneous region with varied healthcare systems, from out-of-pocket expenditure to universal health coverage in some. There is a rapid growth and changing lifestyles. There is the aging population, workforce shortages, which does not only apply to oncology and applies to actually at the moment all disease areas. The availability and access to healthcare and lack thereof, varied ethnicities and cultural taboos, lifestyle and dietary patterns, infectious diseases, lack of patient organizations, environmental pollution, lack of quality data, varied levels of implementation of cancer control plans. But the main challenge for the Asia-Pacific region is the implementation and update of the national cancer control plans. Most countries in the region have NCCPs. However, their translation to practice is lagging. As the implementation of these plans requires resources, prevention and early diagnosis can help reduce new cases, late-stage cases, and decrease premature mortality. With the rising cases and rapid changes in the population lifestyles, the region is indeed set to take the lead regarding the burden of cancer. Thus, the support of medical associations is absolutely crucial, given their reach to the general public and political bodies, and the important work that you do. So we've talked a lot about the aspects concerning cancer, but when we talk about the ideal cancer ecosystem, what are the components that actually make this kind of an ecosystem? And this slide can also be, of course, applied to many other disease areas, but I focused on cancers, and that's the topic that we're addressing today. So we require robust healthcare systems and governance. There needs to be an availability and accessibility to healthcare. Human resources for the delivery of care, i.e. a strong workforce that can help deliver the care to the patients. Solid infrastructure, health information systems, but because without data, it's so hard to do anything. Quality data forms the foundation of any policy that needs to be created. Health networks, strong networks of patient organizations. This is a very important point too, and collaboration across all partners involved. And when you look at the essential investments that are needed to prevent premature mortality in LMICs and LICs, as that's one of the main areas that can be tackled and is a low-hanging fruit. I took a look at the work that has been done by the World Health Organization, and they have done an extensive amount of work in this particular area. Also in terms of the investments that are needed to tackle certain areas in order to decrease premature mortality. And 3 points show up: the prevention of tobacco-related cancers and virus-related liver and cervical cancers, the diagnosis of and treatment of early breast cancer, cervical cancer, and selected childhood cancers, and the widespread availability of palliative care, including opioids. Therefore, if these areas can be invested in the LMICs and LICs, at least the aspect of premature mortality can be taken care of, allowing the professionals to focus on those cases that absolutely need to be treated. Because 40% of cancer cases are preventable and 60% of cancer cases need to be treated. And the crucial role of medical associations, since that's the audience that I'm speaking to over here. So medical associations, such as those that are represented by CMAAO and the entities that are in the audience at the moment, they represent all healthcare professionals. Their role is, together with scientific societies, is crucial, especially in the education, prevention, and control of complex diseases such as cancer. With the incoming wave of cases impacted by COVID-19, we need to do anything and everything we can to prevent those cases that we can prevent. And prevention starts at the grassroots level, i.e. schools. Of course, the general awareness campaigns to the public are absolutely important, but I also believe that when it comes to lifestyle, when it comes to informing the population regarding prevention and what it means to have a healthy lifestyle, if that can be done through interactive measures at schools, then when the children become adults, it becomes much easier for them to understand what is the correct choice, the healthy choice, and when they're making other choices, they're aware of all of the aspects regarding that. Therefore, in conclusion, focusing on the Asia Pacific region and also the region globally, prevention and preparation is absolutely key when it comes to tackling cancer, as the disease cancer is too important to ignore for the country, for the professional, and for the patient. Thank you. Are there any questions?
Thank you, Dr. Malvika. And can we have the floor for the question answers? Okay, so Dr. Angelica, can we have a question from you?
Yes, thank you so much for this very important overview that you gave us. And it is an extremely important topic. I fully agree with you. And you raised an important aspect where you said there's policies in place, but it is how to practically execute those policies. And I think that's where the problem is lying. Because even in South Africa, there's policies in place, but the lack of physical implementing and treating those patients and getting them to the right health care or giving them the right health care treatment is a huge problem. And I think there's not enough emphasis on having the right infrastructure in a lot of the lower and mid-income countries. South Africa is still seen as a mid-income country, but we're actually one of the lower income countries if you look at our current situation. And there is also not enough trained healthcare doctors and personnel to treat those patients. So it's actually a multifaceted problem. It's a problem of funding, it's a problem of implementing, it's a problem of resources. How can one tackle that? Thanks.
That's a very important question. And I think that that's one of the foundations of how we can try to tackle cancer policy, specifically in the lower and middle income countries. Because as you rightly said, the needs of the LMICs and LICs are very different compared to the needs of the developed world. And the LMICs and LICs, you indeed need to focus on the infrastructure, on the workforce, on basically creating the environment to treat the cases, whereas in the upper middle income countries and the high income countries, the infrastructure is already there. So there the focus is, of course, on treating the patients, getting the access to the services and treating the patients. So in terms of tackling this particular issue, and it's a very huge issue that of course I will not be able to do justice to in the time that we have, but one of the things that I could say is that the World Health Organization is indeed doing so much work in the region in order to help the LMICs and LICs build the right infrastructure and try to increase the resources that they have. So in the one of the slides I showed towards the end, you have the essential investments for to reduce premature mortality in LMICs and LICs. And over there, of course, the focus was on preventing the cancers that could be prevented through prevention mechanisms. So if the investments are made based on the resources available in those areas, that can be tackled. The second thing is, and maybe we can talk about this after this call, there are a few tools that are being developed to assist countries in the world to choose where to invest their scarce resources. Because when the resources are scarce, you need to be basically, you need to be investing them in the right way in order to get the best kind of outcome possible. So if you have that kind of a plan, that can be applied to the lower and middle income countries and LICs, it might make it a little easier and as a guidance document to invest the resources in those areas. I hope that helps.
Thank you for the answer. I hope that answers your question. Dr. Angelica was from South Africa. Yes, Dr. Sajjad from Pakistan. Dr. Sajjad, can you please unmute yourself and ask question?
Okay, thank you very much, Surab. I'm sorry I joined late because of my professional commitment. I missed a few important, maybe the important part of the presentation. Well, I am an ENT surgeon, and I'm very much I'm only, but the whole ENT doctors are very much disturbed in Pakistan. I'm practicing in Karachi, Pakistan. Malvika, are you listening?
Yes, I am. Yes.
Okay, thank you very much. So there is a problem here in Pakistan as well as in whole Asia, Bangladesh, India, Sri Lanka. We have a lot of oral cancer, and the main cause, apart from the tobacco smoking or chewing, the betel nut. Betel nut is a main culprit for the oral cancer. If the other colleague will confirm or support me, the betel nut is very much dangerous for the people who are using this betel nut in different forms. They have added some other addictive material with the betel nuts, and we found that a lot of people we are doing oral surgery, and they come to us with a very bad condition, the oral cancer with a very bad condition. So I would like to know, do you have any policy about this root cause of oral cancer or cancer? Because we have very much vocal as a ENT specialist, as a ENT surgeon, and as well as the activist of the Pakistan Medical Association. I am as a Secretary General Pakistan Medical Association. I am very much vocal and providing awareness to the masses to stop eating this betel nuts and cigarette smoking or tobacco in any form. But people are not so much convinced. People are doing, everybody is having their mouth the betel nuts, and they are facing difficulty in talking, but they have to have this betel nut in their mouth. So what would be your suggestion or policy that I can inform the people, or especially to the young people? Young females people are more involved in this activity. Thank you.
That's a very, very good question, Dr. Sajjad, and it also goes back to one of the points that I mentioned earlier, because as you also said, mass campaigns to the general public, they are absolutely crucial. But there you're talking to an entity that has already made up their minds on moving on adopting and chewing the betel nut or smoking a cigarette, or they have, they're already addicted to it. So it's very, very important to continue those awareness campaigns because, like I'm currently in India right now, and Bollywood is very big over here. So the one thing that I absolutely love about what the Indian government has done is that whenever anyone goes to watch a movie or any kind of movie in the cinema or even on television, there's always a very lengthy advertisement or lengthy information campaign when it comes to oral cancers. And I think that's very graphic. Sometimes even I can't see it because it's very graphic. So it really helps, I guess, inform the masses about what's happening. So I'm sure similar campaigns are happening all over the world. But the point that you raised regarding the younger population, I think that is absolutely crucial to address at this moment. And I think that it's something that is overlooked a little bit because of the focus on the mass awareness campaigns. But I feel that if you start the education at the grassroots level, i.e. start when the children are young, start interactive campaigns, interactive workshops, make them understand all the positives and well negatives of and the harms of tobacco use, betel nuts, whatever is endemic to that particular region. Then when the children become adults, young adults, they will be able to make a conscious choice when it comes to either choosing or not choosing. Because when a child is growing up, they absorb everything. And when they become young adults, that's when peer pressure happens. That's when they start looking at what's happening in social media, looking at what's going on online. So if they have all the information they have growing up, they might be able to make the right decision, or at least make a conscious choice. Of course, this is something that we cannot control, but in terms of policies, the one thing that I would suggest is focus on the youth, focus on schools, focus on education in schools, so maybe middle school onwards, and then go from there. But perhaps we can talk about this after too, if you would like. Otherwise, I can.
Okay, actually, I have been doing the awareness program in different institution, teaching institution like school, colleges. So sometime I myself, through Pakistan Medical Association and through the government, the Ministry of Youth Affairs, I am doing this. I am showing pictures,
Wonderful.
the horrible pictures of the oral cancer. So its effects. But similarly, we also demand to the government to ban this sale and manufacturing of different types of betel nuts, sweet supari and sweets betel nuts sort of thing. So we are doing this. Is it enough, or you can suggest something more we can do?
Perhaps we can talk about this a little more offline too, because I do have a few ideas that that can potentially help increase awareness and improve the policy side of it in the region, if that would be okay with you.
Thank you very much. Thank you.
Thank you. Thank you. Can we have Dr. Pillai from India? Can you please go unmute yourself and ask question?
Thank you. It has been a very good presentation, and the roadmap for control of cancer has been well enunciated. You did say that 40% of cancer are preventable, but then the protocol or roadmap for prevention and it's not well laid out, or at least it is not followed. One thing is that although the advertisement on smoking is banned, but you still see that in cinemas and all, the heroes smoke, and definitely the younger generation who consider them as heroes or ideal persons to follow do tend to the habit of smoking. So how effectively we can prevent it, even in cinemas, which has a great bearing on the psyche of the younger generation, and how to convey the message that smoking or alcohol is not good for health. That is one thing. Second is, of course, preventive aspect. Pap smear and mammogram, whether it is to be encouraged or freely done, and there are some views which come that they are not cost effective or not should not be part of the protocol. So what is your opinion on these two issues?
So Malvika, before you answer this question, I have another, like, my opinion and a question. So what I have noticed, and it's a very funny thing which I have noticed. People who smoke are generally outside at the time of the smoking, the advertisement when it comes, because they're smoking and they know that there's an hour where the movies will start a little later. And people who really want to smoke, I have seen a lot of people in the open space, they go outside and they smoke and they come back after probably first scene of the movie has started. So I don't know how effective is that advertisement. But what I've also seen, you talked about peer pressure. People working in the corporate culture. I have a lot of times I've seen that even the bosses, even the peers, they put pressure on younger generation who comes and join and there is a very big note which comes in. Oh, you don't smoke? How will you network with people? Or you don't drink? How will you network with the people? So I don't know how much campaigning is really affecting and how much people who are really into it. Yes, it might affect a younger generation who are not smoking. They might see it. Okay, it's not good for health, and parents also giving a lot of education about all these things that might help. But I think there is more for a campaigning which needs to be done, probably. And I really feel that sometimes when it comes on the health, people really feel that, okay, this is very close to the cancer thing coming up. That is when people start thinking, okay, let's drop the idea of smoking or something like that. So this is what I thought about it.
I think they're all super interesting points, and they're actually really, really correct. So the thing with cancer is, and I think it also might help address the questions that Dr. Pillay and yourself have asked. Because cancer is a disease that takes place inside the body in the very beginning, people are not able to, if people are not able to see something, if it's not tangible, it's very hard for them to put two and two together, saying that, oh, this has an effect on this. So the same thing for prevention too, right? So prevention is something long-term. Prevention, when you say that, don't smoke, have a healthy lifestyle, don't drink, all of these aspects, you're telling a generation and you're saying that, okay, don't do these things because it can potentially prevent a complex disease in the future. So the issue is that because oncology and cancer cases, they are something that cannot be tangible, it makes it harder for those who like seeing 1 + 1 = 2, like seeing tangible things, to understand the link between things that they cannot see. So it's an invisible link. And I think that's where the whole problem starts. And that's where the issue is between prevention and treating a patient in stage 3 or stage 4 of cancer, So coming back to the questions that Dr. Pillay asked regarding the message on smoking and alcohol and what can be done a bit better to inform the public. So as I was saying earlier, because the disease is so hard to visualize, I think it's more about trying to, I guess, trying to make it like for the younger generation. We can always do lots of campaigns, we can do so many things, but I have these ideas that perhaps if you make it more interactive and you make them see what's happening, maybe, or come up with policies which can actually, make them see the link, make the invisible link visible. That's the challenge, and that's what we need to work on. And regarding the second question for mammogram, so breast cancer is something which is increasing, and it's one of the leading causes, the leading cause of death for women all across the world. And I think your question was regarding the cost of the mammogram, if it's cost effective.
It is whether it is cost effective as a preventive measure, and also whether those has to be the protocol for prevention of breast cancer and cervical cancer, pap smear, and
if they have to be in the protocol of the yes. So so that it has yes, so that's the first step when it comes to detecting the cancer. So I personally believe that a mammogram is absolutely important and crucial because it's a very important screening practice that needs to be done, and it helps detect the cases early on. And the earlier you detect the cases, the easier it is for us to treat. I hope that answers your question.
Yeah, thank you. Another thing is that the chemotherapy is so expensive that most of the ordinary people cannot afford it.
Yeah.
So some intervention in that area, it costs lakhs of rupees for many of the chemotherapies. One thing is, of course, availability of the drug, but more than that, the cost is very prohibitive. So any intervention from people like you in this area, where intellectual property rights and other issues are removed so that the cost can come down.
I will definitely take note of that. And yes, access and availability is something which is a big problem when it comes to treatment for cancers. Yeah, so I will take note of that, and perhaps we can talk about this a little more too.
But Dr. Pillai, I just want to add what you are asking about the chemotherapy. The costly is a problem it's a financial issue. This is what we are taking advantage of this problem. We are telling the people, we are awareing the people that this is a serious issue. This cancer will cause your life will be miserable, and you will need to have a lot of money to treat yourself. You have to have a surgery, then after surgery, you will go for the chemotherapy, then radiotherapy, then chemotherapy. So your life will be very miserable. So avoid taking all these causes of cancer, whatever it is. So this is what we are taking this advantage, and we are telling the people, don't use this hazardous thing, which can be preventable. And in Pakistan, Pakistan Medical Association have this slogan that the prevention is better than cure.
Absolutely, absolutely. And also there are there's the medical association. You're doing amazing work. I think all the medical associations here are doing incredible work when it comes to education. But they're also the specialist organizations, such as the oncology organizations. Perhaps if there's a collaboration between the two, that can be even more powerful, because sorry.
Yeah, go ahead.
No, I was saying that can be extremely powerful too, because I think as you were saying, in this particular region, it's a very heterogeneous region. So you're dealing with, on the one hand, you're dealing with a healthcare system where it's essentially out-of-pocket expenditure. That means the patient needs to pay out of pocket to treat the disease that they have, compared to that in the upper middle income countries and the high income countries, where you have universal health coverage in some of the countries, most countries. And the focus over there is on essentially trying to find the best way to treat. So in the lower middle income countries, not only are we dealing with the issue of access, but we're also dealing with the issue of how we can provide the medicines and the diagnostics and the devices to the patients as such. So it's a very challenging area. And I think that a tiered approach is the only way that we can tackle it, because the resources are scarce, the challenges are vast. So we need to find the right way to try to start tackling the issue.
So, Dr. Malvika, we have a few more questions coming up. Before that, we can ask from Dr. Muzikwa, who is the president for South Africa Medical Association. Dr. Muzikwa, go and ask your questions, and then we have further questions from the audience also over here. So we will go ahead with that questions after that. Dr. Muzikwa.
Thank you so much. I'm sorry for not putting on my camera here. It's still early in South Africa. And
it's okay.
Thank you
so
can
much
smile
for and we can have a look at your smile. It's okay. Don't worry. Yeah. Go ahead.
Okay. No, thank you so much for this insightful presentation. No, for me, it's not really a question, but just a comment regarding what you've just said, that 40% of cases of cancer are preventable. And I wanted to harp on that one. The issue about the healthcare system is that it has focused solely on a curative aspect. Even the technologies that are being developed, they are developed towards curative, the curative approach, in such a way that health education, promotion and prevention has taken a backseat. And in terms of the primary health care, it has been so compromised in terms of resources, even by the funding industry. So I think those are the issues that needs to be addressed when we talk about, strategies. Like you said, I mean, that the important thing is that we need to put our stamp on prevention and promotion at schools and young people and stuff like that. But I do think that we have not put so much pressure in terms of what we could achieve by highlighting the importance of prevention and promotion, and having everyone involved in terms of making sure that the communities are educated, but also the corporate world, they come also into the party as well, in terms of resources, making sure that there's accessibility to this information, but also social networks are being used to advance this goal of prevention and promotion of cancer. Thank you so much.
You're absolutely right, and that's why that's why I've emphasized this aspect so much in the presentation, because this is something which is it's overlooked, not overlooked, but it's something which is not focused on that much, because we're focusing very much on the discussions on the curative aspect of the disease. And because the 40% is such a huge amount and it's such a big challenge for the lower and middle income world and the lower income world, education campaigns, investments need to be made in this particular area, because if that's done, then you essentially are trying to reduce the 40% and focus on the 60%. But a lot of work needs to be done in primary healthcare in making sure that, the infrastructure is also upgraded and all the resources are there. And that's something that we're definitely going to work towards that. Yeah.
Okay, so Malvika, I have few questions. So we have seen people wearing masks now. Do you think people, like, I'm not concerned, like, I'm not talking about people who are smoking directly. I'm talking about passive smokers. I'm talking about construction workers, where, all those people. Do you think masking is one aspect which can prevent, rise of cancer in the body? First question is that. And in terms of, the construction worker, people who are into such business lines, what is an impact of lung cancer or all those cancers for them? Is there any research on that, and is there any work done on that? First question is that, and I'll let you answer that before I can ask the second question.
Okay, so when you talk about masking, so you're asking if masking can help prevent new cancer cases in general. So I think cancer does not usually spread. It's not an infectious disease. So masking can prevent infectious diseases, but in terms of links to oncology, it's not. There isn't any link, not that I know of. However, the second point that you mentioned, when it comes to those people working in the industries where they inhale a lot of chemical fumes and a lot of chemicals, their masking is absolutely crucial, because there is indeed a link. As one of the slides that I mentioned, there was a slide where the challenge was environmental pollution is one of the big challenges of the Asia Pacific region. And yes, the pollution is now air pollution, water pollution is being increasingly linked to cancer cases. So in terms of that, pollution is an aspect. Those working in the chemical industries, where, for example, asbestos is quite prevalent, masking is absolutely crucial. But when it comes to common cancers, of course, there's no link between wearing a mask and reducing the number of cancer cases, preventing cancer.
Okay, and the second question is like, I know a family where, they were traveling and they met with an accident. They were absolutely normal people. The accident just came up as a blessing in disguise, because when they went for a complete body scan, instead of the accident problem, they found out there was a cancer in the body, which they were not aware, which probably, as I said, it was a blessing in disguise for them to have an accident, which they were saying, oh, they met with an accident, they had a bad luck and all that. But after that, when they realized there was a cancer in the body, it was probably blessing in disguise, because they could detect the cancer earlier stage. If they would have not had that accident, that would have probably gone to a second or a third stage to come up. So how do you, this question is probably for a general public, because there's an audience which is also a non-doctor audience over here. How, what do they do? What do they need to do? Mammography, I know, is one of the tests which for a woman above 50, should get it done to rule out a breast cancer. For coming a question on a Facebook, what prevention general public needs to make sure that they don't have a sleeping cancer cell in the body which can get activated anytime.
Yeah. So the one thing that I would like to make clear, I'm not a medical oncologist, okay? But the one thing that I can say is that you have to, I think prevention is indeed the best cure, but knowing your body, that's even more important. So the only thing that I recommend to, or I suggest to even, I'd say the people I know, is that you need to know your body, you need to know any changes. And if you see that there is any change in your body that has lasted for a few weeks, a month, go get it checked out. Because in oncology, the best way to treat the disease is to find it early. If you find it early, i.e. through population-based screening, or through as you said, so circumstances where you have to, you've had an accident, or things happen, so you are in lucky circumstances, not well unlucky, but lucky circumstances from that perspective. Those are very rare occasions, but most of the people in the population, they need to be able to take care, understand their body, be aware of it, just be wary of what's happening. And because the symptoms of many of all of the different diseases that form cancer, they're very normal, they're very normal. So sometimes you ignore a cough that has been there for a month or 2 months because you're like, well, it's a cough. So you need to start, one would need to start paying more attention and just taking care of themselves. That's the recommendation or the suggestion that I would make, but I'm not a doctor, so I would request them to consult the medical professionals on that.
Absolutely. And Dr. K.K. Agarwal used to say any change in the body after 30 years of age, which is probably unusual, which you have not seen it, go and consult a doctor. Don't even think about it.
Exactly. That's the only way you can prevent and find anything which might be untoward, or any surprises.
Malvika, I must appreciate you, as you said that you are not a clinical oncologist, but your answer is just like a clinical oncologist. It seems that you are examining the patient, and very good. Fantastic. Thank you.
Thank you.
Dr. Salma, Pakistan Medical Association, can you please ask a question, please?
Good morning, everyone. I'm very sorry I joined late, so I missed most of the talk, and I'm sure it was very good. What I wanted to add was I have a very high rate of CA in my family, any kind of CA. Every natural death that occurs is courtesy cancer. So nobody has really advised us, although I went to MD Anderson and all these fancy places and asked them to make a protocol for us. So the little that I've learned down the line is for my family that everyone should get a sonography of the torso, which is the breast, the abdomen, the reproductive area every 6 months. All the ladies and even the men. Above the age of 50, mammography every 2 years. Colonoscopy every 2 years. And if they have some GI problem like dysphagia or anything, endoscopy is mandatory. So this is what is keeping my cousins and myself and most of my family members who are following this quite safe. Because one of my cousins, because of this sonography, got a tumor in the kidney. Another one got it in the prostate, and it was all caught and diagnosed in time. So the thing is, we have to have medical backup. We have to go for these tests. Then again, we have to have regular pap smears. The ladies should be recommended that. That's even recommended for normal people at least once in every 2 years. Not 2 is mandatory. So this is the little that I know, and I wanted to add up. And a chest X-ray once in 2 years won't harm you, but it might give you a nice input into what is happening. So that is it. That is my 2 pence to the subject. And I hope you're all and we are all cancer-free and we lead normal, nice lives. Thank you.
Thank you, Dr. Salma. Do we have a question from Dr. Alvin, or do we have a question from Dr. Akhtar Hussain? Dr. Alvin from Hong Kong Medical Association, are you available? Okay.
Hi, good morning, Sharab. It was an excellent presentation. The question is, if smoking is preventable and is one of the cause for lung cancer, is this industry so strong we cannot stop or ban cigarette smoking because actively and passively both causing harm in the body? Any comment and any study on that? Thank you.
I think one of the primary reasons I know is that, smoking is one of the most, the cigarettes are one of the most tax friendly for the government. So I think an industry which cannot be ignored by the government, they cannot completely ban it. There's a huge debate. Even e-cigarettes came into the place. So all those questions are available on the forum, but I'll let Malvika to answer those questions. So the question which he's asking is, if we know that the cigarettes are the cause and the treatment for the cancer, so why not to ban it? Why is that's not done till now?
So in terms of tobacco use, that's something, the link between tobacco and cancer is indeed very clear, and quite a few studies have been done on that, and that's the challenge that we're all trying to face and trying to tackle, to see what we can do to reduce that the consumption of tobacco through the help of public policies, and try to reduce the number of cases with cancer regarding where there's a link, where we can at least.
Thank you. I saw Dr. Alvin opening the camera, and I was trying to. Dr. Alvin, do you have a question, or do you have any comments? Okay, so he has to leave for a duty. He's from Hong Kong. So I think we have done with the question answers from the entire people over here, entire medical associations. And I think we are done with the time as well. So I would really thank for a wonderful presentation and a wonderful knowledge session. I would invite you again for one of the follow-up sessions, or not while you're traveling, but whenever you're free, let me know. Whenever you're free, we can do a follow-up session. For people over here, just to remind, this session was live on probably more than 9 or 8 social media platforms. The link will be available shortly. And Malvika, I will send you the links as well. So if anybody wants to review this presentation, give a feedback, please do that. And we always encourage to bring more and more topics so that we can be all aware. So today, I think one of the presentation we have been enhanced with the wonderful knowledge from her. So thank you so much for joining in, and see you again on this forum again.
Thank you so much. It's been a pleasure. Thank you very much.
Thank you. Take care.
Bye-bye.
Thank you.
Bye-bye.
Bye-bye.